welcome back to the Medical Projects YouTube channel. If you are new around here, my name is Olivia and I'm a second year medical student at King's College London, and here on this YouTube channel we create content to help you get your dream spot at medical school. So I share my journey throughout medical school and show you what it is all about, whilst giving you my best bits of advice to ensure that you get your spot at medical school as well. So if you do like the sound of that, make sure you subscribe to our YouTube channel, turn the notification bell on so that you can be notified when we post, and also make sure to go and follow us on all of our social media accounts. We love talking to you guys and answering any questions you may have, so make sure to check us out on there too. I'm trying out a new lens today, I'm really excited about it, so do let me know what you think. I'm still getting used to it, so I hope this looks okay. Now for today's video, we are doing another one all about the UCAT, but specifically we're going to be looking at the Situational Judgement section. So if you're new around here and you're wondering what on earth the UCAT exam is all about, it's basically an entrance exam that many medical school applicants have to sit in order to be considered for interview for medical school. So it's comprised of 5 individual sections, and the 5th one is called Situational Judgement. And it's often the one that's quite ignored, which is why we wanted to focus on it today. It is scored slightly differently to the other sections. The other sections are scored from 300 to 900, 900 being the highest and 300 being the lowest, whereas Situational Judgement is scored in a banded fashion, from band 1 being the highest to band 4 being the lowest. Now the reason you don't want to neglect Situational Judgement is because many universities consider that a really important part of your UCAT score. So for example, even if you manage to get an incredible average of 750 in the other 4 sections, if you end up with a band 3 or a band 4 in Situational Judgement, many universities won't even consider you. So it's one that you really want to nail, and it's, I would say, a fairly straightforward one to do really well on. Now when I did my UCAT exam, I scored band 1 in Situational Judgement pretty consistently, which I was very proud of. So I'm here today to tell you my 5 top tips to get a band 1 in Situational Judgement too. So without further ado, let's go on with the video. Now before we dive into my top tips, I do want to explain a little bit more about how this section works. So you have 26 minutes to answer 69 questions. It's definitely not the most time pressured section on the exam, but having said that, it is the last section of the exam and it is a very fatiguing exam, so by the time you get to this section you are going to be feeling pretty exhausted, so it's really important that you keep that momentum going. Now there's also 2 different types of questions. So you're going to have your appropriateness questions and you're going to have your importance questions. So you'll be asked how important a consideration or action is in a scenario, and you'll be asked how appropriate an action or consideration is in a different scenario. Now I'm not going to go through the specifics about how to exactly tackle these questions, because we do actually have a free webinar coming up that you can sign up for, and I'll make sure to leave the link in my description box, and that will talk you through how to answer those questions. Instead, I want to give you my top tips to make sure that you smash this section. My first tip is to become very familiar with the themes that are being assessed in this section. So within this section is comprised of a multitude of different scenarios, and these scenarios are all testing how you would act as a professional. Now within these scenarios you're going to be seeing reoccurring themes, things like integrity, honesty, empathy, teamwork, communication, to name a few, and all of those are really important themes when it comes to becoming a doctor. So you should always be telling the truth to patients, you should be owning up to mistakes, you should be empathetic when something goes wrong or when there's a difficult diagnosis. All of these themes are core material and they will crop up over and over again in this section. So it's really important that you're able to read the scenario and immediately identify what's being assessed. So the best way I think you should do this is by reading GMC's Good Medical Practice. This is the most important document when it comes to doing situational judgment, and everything you need to know about what is right and what is wrong and how you should act as a professional is within that document. So that is my biggest piece of advice for this section. Make sure you're really familiar with this bit of material. The next bit of advice I have for this section is to understand your role within the scenario. So within the scenario, immediately it will usually say something like you are an FY1 on a busy A&E ward, or you are a medical student on placement with another student. So it's really important that you take note of who you are in the scenario, because that will alter your actions you take slightly. The themes are going to stay the same despite who you're playing in the scenario, but if you are a doctor, you might be expected to deal with situations slightly differently than if you were a medical student. So for example, as a medical student, it might be more appropriate to escalate any concerns or things that you witness to a senior or a tutor, whereas as a doctor, you might tackle that head on depending on the situation. The next tip I have is to act as a professional, not as yourself. Now, we'd like to think that in day-to-day life we are holding ourselves to high standards and we're fairly professional in our day-to-day life, but there just are some certain scenarios where as a medical student or a doctor, you may take some actions that are slightly different to what you would do in your personal life. What I mean by this is, in my personal life, if I was witnessing my best friend doing something a bit strange or a bit unprofessional, I'd probably go straight up to them and, address it, or if I didn't think it was my business, I'd probably ignore it. But on a ward, if you are with your best friend and they are also a medical student and they are acting inappropriately, it's not something you can ignore, and it's not necessarily something you can tackle head on. There will be scenarios where it's requiring you to report your best friend or to report something that you see, and that may not be what you would do in real life, but as a professional and as a doctor, it is what is going to be expected of you. So it's very, very important that when you're doing this section, you get into the headspace of a junior doctor and a medical student, and not as your normal day-to-day self. The next tip I have is a really, really important one, and it's something that a lot of people don't actually realise, and that is that you can get partial marks in this section, and that is very, very distinct from the other 4 sections of the UCAT exam. So for example, let's pretend we have a scenario that's testing the importance subtype of questions. Now within these questions, you'll have 4 options, being very important, important, of minor importance, or of no importance whatsoever. So say for example that you say the answer to a question is that this consideration is important, but it actually turns out that the correct answer is very important, you will still get partial marks. Likewise, in the appropriateness section, if you say something is a very appropriate thing to do, but the correct answer is appropriate but not ideal, you will still get partial marks. However, if you'd picked the answer as being a very appropriate thing to do, but the real answer was very inappropriate, you would not get half marks. So what I'm trying to say here is that it is really, really important that you get on the right side of the question. So even if you don't get the perfect answer, as long as you're choosing between right and wrong, you're still going to get partial marks. And the only way you're going to get better at that is by practicing and identifying the themes and knowing when, this is a theme about maintaining trust, and I know that in previous questions this is always a very inappropriate thing to do. That's how you will start identifying which side to pick. Finally, my final tip for this section is don't overthink it. I know it's easier said than done, but owing to this section being the last one where you're feeling pretty fatigued, and owing to the fact that this is perhaps one of the less time pressured sections on the exam, it really gives you scope to sit there and overthink your answers in a lot more depth than on the other sections. And I really think that by the point you're sitting this exam in real life and you've done loads of hours of practice, your gut feeling is the one that is usually correct. 9 times out of 10 I would say it is correct, and you should trust that feeling. So if you think that this is something I've seen before and it's a very appropriate thing to do, pick it. You can always flag it and then come back to it later on, but don't overthink it because you will end up changing your answers, and trust me, I always do that and it always comes back to bite me. So to summarise, my tips are: understand the themes that are being tested in this section, and to do that make sure you're reading the NHS Constitution, good medical practice and any similar documents. Also understand your role in the scenario. Are you playing a medical student? Are you playing a doctor? Are you just playing an innocent bystander? Also make sure you act as a professional, not as yourself. Sometimes the actions we will take in professional scenarios may not align with what we would do in real life, but the important thing is that you're thinking as a professional. Also, make sure you get on the right side of the questions. Remember, you will get partial marks even if it is not the fully correct answer. And finally, do not overthink this section. Make sure you become familiar with the themes, understand when something's inappropriate and when something is very appropriate, and you will smash this section. So those are all of the tips I have for our situational judgment section today. Also, just a reminder, we are running a UCAT crash course and also a UCAT masterclass over summer. So if you really want to get a broad overview about the UCAT and see what it is all about, I really recommend checking out the crash course. It's a day-long interactive online event, and the masterclass is for those who are feeling a bit more confident but really, really want those extra tips to get the edge over everybody else. Thank you guys so much for watching once again. I really hope you found this video useful. Let me know if you've started preparing for your UCAT in the comment section below, and also let us know what videos you would like to see in the future, because we are going to be very busy over summer creating lots of content for you all. Thank you guys so much, and I'll see you in another video very soon.